Hi, I'm Dr. Mike Milligan. I'm here now with Dr. Ryan Swain from Rochester, New York, of 6 Month Smiles. And this is great. You're really going to want to pay attention to this. Ryan, thanks so much for joining us here.
Thank you.
We're here at the Aesthetics meeting in Tampa, Florida, Aesthetics. And a couple of the top producing presenters have been talking about, that were presenting this morning, the keynote speakers, were saying, you've got to do 6 Month Smiles. So I pulled Ryan aside, the president and developer, and he's agreed to visit with us here. So Ryan, tell us about 6 Month Smiles and why you got started in this and when and what you're doing with it.
Well, like most general dentists, when I came out of dental school, I knew little or nothing about orthodontics.
And that wasn't too long ago. You're young.
That's right. I graduated from the University of Florida in 2002.
Okay. Great.
But I always had an interest in ortho. I always wanted to get into it. So I was considering going back for an orthodontic residency, and I found out about some dentists, particularly one in Boston, who was doing a short-term orthodontic procedure where he was treating adult patients with orthodontics in an average time of 6 months.
Okay.
So I learned how to do it from watching some of these dentists. And
that's pretty quick, 6 months.
It is. It is.
That's real quick. Okay.
That's right.
Go ahead.
And that's the whole selling point to the patients, or what makes it attractive is really what we've done with 6 Month Smiles now is we've taken it, started teaching courses on it, and we've developed it really into a turnkey system for general dentists. And what we do is we use tooth-colored wires and braces.
Okay,
and
so they're pretty much invisible.
That's right. Very inconspicuous appliances. That's part of what we call the magic formula.
Right.
And the other part of it, of course, is the short treatment times.
Okay, so what are you doing with this? What all are you treating with 6 Month Smiles in 6 months with these? It sounds like it's very inobtrusive and something that the patient would feel very comfortable doing, and that's important for the population you're talking about here.
That's right, and it's specifically to address the needs of those adult patients who aren't interested in traditional orthodontics. You know, traditional orthodontic treatment is the ideal treatment in most cases, and that's what we would recommend for most adults or children that have crooked teeth. But when an adult says, I don't want to do that, I don't want to wear metal braces, I don't want to do it for 2 years, just like Invisalign has come along as an alternative for those adult patients, using clear aligners. And what we do with 6 Month Smiles is we're using brackets and wires because the tooth movement is efficient, it can happen very quickly, and ultimately we're focusing on the patient's chief cosmetic complaints. It's not a replacement for traditional ortho, it's an alternative for those who don't want it.
Okay, great. So what, we're talking about the front 8 teeth, or what are we talking about here?
Most of the cases are bracketed first molar to first molar, upper and lower arches. So we're moving most of the teeth in the mouth. If premolars are rotated or twisted, if there's spacing in the posterior. So it's not just anterior movement. But essentially what we're doing is we're doing about 90% of what's accomplished with traditional orthodontics, and we're letting go of that 10% that takes a long time to do. Those 3 main things that we're letting go of are, 1, changing the patient's angle class. So if they're class 2 when they start, they're going to be class 2 when they finish. Just like if we did a set of porcelain veneers for them. You know, we're making their smile look nicer. But in this case, rather than prepping the teeth for veneers, we're just simply gently moving them into a new position.
Sounds great.
The second thing that we're letting go of is significant buccal lingual root movement. It takes a long time to move the roots of those teeth through the bone buccal lingually. And so we're just recognizing takes a long time to do that, so we're letting go of some of that movement. And the third thing is a significant midline change. So if someone has a midline deviation that's relatively significant, more than 3 or 4 millimeters.
Need to move things around to correct. That's not where we're going with this.
That's right. So those 3 things really are what we're saying. It takes sometimes 2, 3, 4 years to correct those things, and that's the big hang up for adults. They don't want to wear the braces for that long. But most adults, they have a tooth that's sticking out, lower crowding, spacing. Most cosmetic complaints that adults have, we very safely and easily can correct with clear braces in about 6 months.
It's really cool. So you've been doing this about 6 or 7 years, you've been teaching this about 4 years, and you're growing quickly.
That's right.
Tell me about that.
Well, because what we offer with 6 Month Smiles is a turnkey, systemized way for general dentists to add ortho to their practices. Most general dentists maybe have dabbled in ortho, or they do some Invisalign or other removable appliance, but ultimately fixed ortho for most general dentists is something that they've kind of stayed away from. It's been a mystery too. So what our system does is not only through our seminars, but through the way that we provide materials and case setup and support for our providers is it makes it a real systemized turnkey method. They can learn the procedure, learn the process in a 2-day hands-on seminar.
Oh, great. That sounds great. Okay.
Yep, and the costs, the upfront costs are very minimal.
What's the cost?
Well, the seminar cost is about $2,400.
Okay.
And as far as the tools and supplies that are needed to have in the office to treat these patients, it's about another $2,000.
Wow. Okay. So that's very inexpensive then.
Right.
And after a 2-day course, you're able to move forward with this then.
That's right. We've trained over 1,000 dents, and every month we hear that question: can I really learn how to do this in a 2-day seminar? What we do is it's a very focused approach. Very strict principles. If you stick to the principles and you select the right cases, and you have good patient communication, it's hard to fail with these cases, because one of the things that's freeing about 6-month smiles compared to traditional orthodontics is that since the goal of treatment is to give the patient a smile that they feel good about, if we've accomplished that goal, the case is a success. Whereas when general dentists try to get into traditional comprehensive orthodontics, they're treating cases over 2-3 years, and their goal is this rigid, ideal finish where the teeth have to touch exactly in the right spot, and they're trying to get that perfect finish. That can be frustrating because it's hard to get.
You bet. Tell me about stability of these cases then, because you go to that angle classification for stability. You get the teeth in exactly, you move them through that buccal bone and whatever to get them in the right position for stability. What's the stability of these cases? Sure.
Well, retention is obviously very important. The last thing we want to do is move the teeth and give the patient a great smile and then have things relapse or have things change. So really, regardless of how we move the teeth, whether it's with Invisalign, 6-month smiles, traditional braces, a spring retainer, teeth can relapse. So part of what we do in our system is we make sure that the dentists not only understand what the best protocols are, and we offer removable options and fixed options for retention, but we make sure that the dentists understand clearly how to present those options to the patients and how to make sure that the teeth are going to stay in the right position. Now, as you mentioned, with these cases, because we're not finishing all the time with an ideal, perfect bite, no overjet, no overbite, there is a little bit more of a need for retention because, of course, a perfectly equilibrated occlusion is a great retainer in and of itself. So when we don't have that, we have to be extra assertive with our retention, and that's a big part of any orthodontic treatment.
But you've been doing this for quite a while, and you're seeing great retention, and you're getting great. And the speakers today were talking about the results they were getting. A wonderful patient service for patients that don't want the full 2, 3, 4 year situation. Now, what about the fee to the patient?
Most of our providers are charging somewhere in the range of $3,000 to about $5,500. In my office, this is all that I do. I have no hygiene department. I'm not doing much general dentistry. This is what I love to do. The patients love it. The atmosphere in the office is great. We charge $4,500, and that includes teeth whitening, and we include whatever retention choice they choose in that as well. So most dentists are charging slightly less than what the average comprehensive fee in their area is. So you can imagine, 6-month treatment with a fee that's similar to traditional ortho, the profitability is just enormous. The potential is enormous.
It's a great service with great potential. It's a win-win-win is what it is.
That's right. It's conservative. It's focused, it's patient-friendly, it's dentist-friendly. Well, that's what we do with 6-month smiles is we make it dentist-friendly by making it systemized, by providing case setup, case support. Because ultimately when dentists are looking for a procedure, add something new to their office, they want something that's going to be predictable, something that's going to be relatively low stress, and something that's going to be profitable and a great service for their patients.
Right, so basically what you're saying is, we're pretty we're well trained in the mouth and all. You can add this service for minimal cost and minimal time involvement. It's a win-win-win for everyone. And basically, a case or two, you're going to pay for your course and materials and everything.
That's absolutely right.
And we see. Oh, go ahead. I'm sorry.
I was just going to piggyback on that by saying a lot of things that dentists think about getting into. There are some great services, laser perio, CAD/CAM dentistry. Those are all things that can be great profit centers and great treatments, but usually a pretty hefty investment up front to do those. And so that's one thing we feel really good about is knowing we have a great training course for our dentists, and that there's really not much risk as far as financial, because as you mentioned, 1 or 2 cases that you've already...
There's no risk here. What percentage of the population out there, what percentage of a practice's patients coming in would qualify or would need this type of a service?
I don't know if I have an exact number for you, but people will often ask me, what's the demographic for 6 Month Smiles?
Okay, great.
Yeah, and I'll usually say people with crooked teeth. And it really is as simple as that. Now,
that's a lot.
Yeah. And what it comes down to is if someone has a cosmetic discrepancy and it's primarily due to tooth position, that's exactly what we're treating. We're moving the teeth into a position so that there's more symmetry, more harmony within the smile, and giving them something symmetrical, because there's all these adults out there who think they're stuck. They think they don't have any good options. They've considered porcelain veneers, but they can be aggressive or expensive sometimes. And so what this does is it frees up general dentists to treat those patients. And as you've mentioned, it's a win-win for everyone involved. One other thing I just want to mention, because the question we always get is the age. What age patients can we treat with this?
What age patients can we treat with this?
Good question. I'm glad you asked. In my office, we treat 15 years and older. Okay, and then in our seminars, that's really what we recommend. Our philosophy, our treatment philosophy, was actually, it's a quote from Dr. Vince Kokich, who's a very well-respected orthodontist, and what he said was, kids should be treated idealistically, and adults should be treated realistically, and that's our philosophy. Yeah. 15 to 18, the teenagers, I'll definitely treat patients in that age group, but I want to make sure that if there's a parent involved in the conversation or with the patient, that they understand the scope of treatment, that it's not a replacement, a complete replacement for traditional orthodontics. Yeah. And then of course, once we get older than that, to where patients are old enough to make decisions for themselves, once someone tells me that there's no way they're wearing braces for a couple of years, then
and we hear that a lot.
Right. Then for me, then the next conversation is, well, we have a couple different options, but 6 Month Smiles is usually the one that they pick because of the cost and the time frame.
You bet. So how do we find out more about this?
Well, the first thing, if you're interested in finding out more, would be to go to our website, 6monthsmiles.com, and the 6 is the number 6, 6monthsmiles.com. That'd be a great place. There's some videos that you can watch there. There's also a lot of information about how the procedure works and the seminar dates, locations, and things like that. We do monthly courses all around the country, in the UK, and we get great feedback from our dentists, and we're proud of what we do.
Well, that's what I was hearing at the meeting today as well, and I'm going to sign up for one of your courses for sure.
Great.
So I look forward to that.
All right.
Okay. Thank you so much.
Thank you. Thanks a lot.
Great.